Have your patient sitting with their head in a neutral position. Position the goniometer with the axis of rotation on the external meatus, the stationary arm perpendicular to the ground, and the mobile arm aligned with the nares, or bottom of the nose. Normal neck flexion is 50 degrees. She has 45 degrees. During neck flexion, the head moves in the sagittal plane on the mediolateral axis. Have the patient lie supine on the table. Align the axis of rotation with the front of the acromioclavicular joint. The stationary arm should be parallel to the thorax, and the mobile arm is going to be following the midline of the humerus. Normal range of motion is 180 degrees. She has 175. Have the patient lying down in a supine position with the lower body in a neutral position. Align the axis of rotation with the greater trochanter of the femur, the stationary arm aligned with the pelvis in a neutral position, and the mobile arm aligned with the lateral epicondyle of the femur. Go ahead and flex up for me. Normal range of motion is 120 degrees. She has 112 degrees. Flexion of the hip falls in the sagittal plane along the medial-lateral axis. Have the patient place their arm comfortably on the table with their palm up. First, assess their comfortable range of motion by having them flex their wrist up towards themselves on the pinky side. Then, stabilizing the forearm with one hand, I'm going to be grabbing the base of the fifth metatarsal and pulling into extension and radial deviation. A 5 out of 5 is going to be an unbreakable muscle strength of the wrist with no pain. The flexor carpi ulnaris originates in the medial epicondyle of the humerus and inserts in the pisiform bone of the wrist. The actions are wrist flexion and ulnar deviation. Have your partner lie on the table on their side with their testing leg on the bottom. Instruct them to raise their top leg to about 25 degrees and assist them right above the knee with one of your hands. With your other hand, as they bring the testing leg into adduction, apply a downward force right above the knee. This is testing hip abduction. The adductor brevis and longus both originate in the pubis and insert along the proximal linea aspera and the midline of the linea aspera, both acting in hip adduction. The adductor magnus inserts or originates in the pubic rami, ischial-rami and ischial-tuberosity, and inserts along the entire line of the linea aspera, also acting in hip adduction. Have your patient lie down on the table in a supine position. Instruct them to place both hands behind their head and perform a twisting motion. Their left elbow is going to go towards their right knee. Go ahead and perform the motion. This is going to be testing the left external oblique and the right internal oblique. Watch their scapula as they perform this motion, as a 5 out of 5 is when both scapula are able to leave the table. Your right hand during this motion is going to be ensuring that their head does not hit the table throughout the motion. This is going to be performed in the longitudinal axis in the transverse plane. The external obliques originate in ribs 12 through 4 and insert in the linea alba, pubic crest, ASIS, and iliac crest. The actions are flexion and lateral bending of the trunk. The internal obliques originate in the thoracolumbar fascia, iliac crest, and insert in the linea alba, pubic crest, and ribs 9 through 12. The actions of this muscle are flexion and lateral bending of the trunk.